about why you're here today, about CKD policies that we need to care about. I understand you've been a nurse practitioner for 38 years. You're a past president of the American Nephrology Nurses Association, and currently you are their representative with Kidney Care Partners and their Health Policy Committee chair. Very important positions. What would you like to share with us today?
Well, I've got a few slides to review that'll help guide us through this, and just want to say good afternoon to everyone. And I would like to thank the Renal Support Network for allowing me this opportunity to be with you today to really share my passion, which is advocacy. So some of the things I'm going to review today is why should people get involved? And I want to review some key federal health policy initiatives and where to begin. So why really should we get involved? Well, increasingly health policy is being made by elected officials who are not particularly knowledgeable about healthcare, or more importantly, the needs of people with kidney disease. And they need to be educated to make decisions that may impact care, whether it's a budget standpoint, a resource standpoint, or even to identify those measures that matter. And CMS was talking about some of those. We know that there are hundreds or actually thousands of bills introduced in each legislative session, both on the state and federal level. Last year at the 116th Congress, which is from January to January, there were 16,601 bills and resolutions that were introduced. From that, only 2% were enacted into law, 4% were passed by resolution. Only 746 or 4% got a vote, and 24 were considered failed legislation, with 9 that were vetoed. That left 89% of bills without any action at all. So we know there's many opportunities to participate in lawmaking. And when we look at that volume of bills, especially if they're important to us, we really need to get a handle on the process. We know that a bill gets introduced, and once it gets introduced, then it's assigned to committee and then a subcommittee. If it doesn't, the bill doesn't move forward. And then they review it. The subcommittee would review it. They have what we call hearings and markups. And if that doesn't happen, the bill doesn't move forward. And if it does happen, then we need to make sure that the intent of the bill stays the same. If it passes out of that committee, it's actually not even guaranteed then to go to the House or the Senate to be voted on. So if it's not a priority for the House and the Senate, then it just kind of sits there and basically goes nowhere. And once it does get approved, then we need to wait for the president to either veto it or sign it into law or do nothing with it. And it just kind of, again, goes nowhere. So once it's signed into law, then it goes into the regulatory process. So getting involved makes a difference. Only one thing can help with change of the course of this disease, and that's for anyone that's affected by it, whether it's a person with kidney disease, a family member, or a healthcare professional, is to get involved. Educating your elected officials is really a critical part of that process. And everyone that's attending today has an experience with kidney disease. And your story is really a great way to educate your elected officials. So what do we know? Well, we know we're a very large and actually, quite frankly, a very expensive program. And just to make sure the language is consistent, I'm sure many of you already know this, but chronic kidney disease, I'll be referring to as CKD. And end-stage kidney disease, or ESKD, is newer language. However, with health policy, it's still known as end-stage renal disease, or ESRD. But both ESKD and ESRD means that people require dialysis or transplant for survival. So if you look at some of these stats, and you may know them already, have heard them during this seminar, but approximately 37 million, more than 1 in 7, may have chronic kidney disease, and it's estimated that 90% don't know it. We do know that every day more than 340 people begin treatment for kidney failure, that's dialysis or transplant. And again, these are just Medicare costs. For the care of CKD, it costs $84 billion per year. And end-stage kidney disease is $36 billion. And I did include the breakdown for dialysis. So we know, again, we're a very expensive program. And saying that doesn't mean we need to cut it, but you can imagine we are always on the radar when they look at budget to look for avenues to cut. And we need to make sure that we're always on alert to defend our resources for high quality care. So understanding the difference between legislation and regulation is actually very helpful in the opportunity to make an impact. Legislation is really the law passed by a legislative body, which of course is Congress, and that includes the Senate, of course, the House of Representatives. Right now, we know that there are 2 senators per state, so 100, and there are 435 elected House representatives. That is divvied up between the 50 states, all based on population. When we look at the state level, every state has variations in the operation of their government, and it would be impossible to review all 50 states. However, many of them have this information ready available to you. And all you need to go is to their websites, and it's your 2-letter state abbreviation.gov. I'm from Michigan, so it would be mi.gov. So there's information that is certainly readily available. So again, once a bill is signed into law, the focus then shifts to the regulatory process to ensure that the law is enacted and meets the intent of the law. So basically, they set up the rules or guidelines from the executive bodies to determine what that law really is going to be rolled out to mean. So Congress enacts legislation, but they cannot implement it. So it's the executive branch that is charged with the implementation. However, Congress does have oversight power. Therefore, Congress does oversee the administration of Medicare, including the ESRD program, by the Centers of Medicare and Medicaid, or CMS. We know that regulation plays a major role in healthcare and healthcare insurance coverage. We know the regulatory agencies are responsible to protect and regulate the public health at every level. So once a bill is passed, it is then further defined for implementation. The good news is the regulatory decision-making process does allow for a period of public comment. So it's a great opportunity to provide input, because who knows better than someone who has lived the experience, whether it's a family member with kidney disease or a healthcare professional. Regulatory decisions are made at either the state or federal level, so the process is usually the same and can impact more than just healthcare. It's also public health, your environment, and your safety, so even more of a reason to get involved. The Department of Health and Human Services, or HHS, protects the public from a number of health risks and provides a lot of programs for public health and welfare, and that's where a lot of the healthcare initiatives go. So I just like to bring this up because it kind of sometimes the language gets a little bit confusing. So we have Health and Human Services, but under their domain falls the regulatory agencies. Many you're probably already familiar or have heard many times, like CMS, the Centers for Drug Control and Prevention, the Food and Drug Administration, National Institute of Health. So again, all these fall under HHS. So with CMS, we know it's another regulatory agency who oversees most of the regulations directly related to the healthcare system. They do provide government subsidized medical coverage through a number of programs, including Medicare, Medicaid, the state's Children's Health Insurance Program, and of course, the ESRD program. So with that background, let's go ahead and slide into some key federal legislative initiatives. The ones I'm going to review today is Advancing the American Kidney Health Initiative, or AAKHI, the Living Donor Protection Act, the Chronic Kidney Disease Improvement Research and Treatment Act. I also want to touch on some of the telehealth initiatives. And I'm a little bit biased because I'm a nurse, but I'm going to touch a little bit on a couple of nursing priorities, and don't worry, I won't spend too much time on it. So Advancing American Kidney Health Initiative is actually an executive order. It was announced by the president on July 10th of 2019, and the rollout has continued today. So that's why it's important we bring it up. This agency-wide strategy was intended to shift care from in-center dialysis clinics to home dialysis and really encourage more kidney transplant, as well as improve the quality of life for people with kidney disease. And of course, there's always the overarching that they want to reduce costs. The president signed the executive order and put into motion many new policies regarding treatment and payment of kidney care. And the goals were really to reduce the number of Americans developing end-stage renal disease by 25% by 2030. So they're very big, broad goals that obviously are going to require health policy to figure out how to address them. More than 80% of new ESRD patients, they want to go to home dialysis or transplant by 2025. They want to double the number of kidneys available for transplant by 2030 and include proposals that are mandatory and voluntary payment models, as well as the transplant proposed rules. So we've already seen some of this occurring. So I mentioned laws, I mentioned regulatory agencies. So what exactly is an executive order? And executive orders can occur on the state and the federal level, and we have seen a lot of them with COVID-19. But they are official directives to federal agencies that allow the president to move forward with policy changes without the involvement of Congress. It does not necessarily create new laws, but they are enforced the same as if Congress had enacted a law. And with this executive order, we do need Congress to enact laws in order to achieve these outcomes. Congress can revoke executive orders through the passage of legislation, and they are subject to cancellation by federal courts if they're found to be unconstitutional. So there are some checks and balances, which is always a good thing. So what have we really seen with this executive order? Well, some of the key proposals were related to new payment models, which we're going to cover briefly, the organ donation policies, but not all are related to legislative policies, but rather some are initiatives, and there actually have been many to improve technology awareness of kidney disease and to bring a greater awareness, especially to that 90% of the estimated 30 million Americans who may not know they have kidney disease. And those are kind of ongoing initiatives, and they're working with all departments on them, and they're pretty exciting. The end-stage renal disease treatment choices, or ETC model, really builds on the concept of value-based care. So instead of being paid by volume, we're moving to a reimbursement based on the quality of care. So measures are involved, and really, I know there was a presentation on measures, but I just want to reiterate, it's very important that everyone get involved, because as we look at measures, we need to make sure they're measures that really matter, and they're meaningful, useful, and not only that, that they're reliable and valid, that they're actually going to measure what the intent is. Well, the ETC model actually began January 1st of this year and will go until January 20th of 2027. So why are we reviewing it now? Well, I think we can anticipate changes along the way. And I think we need to be ready to monitor what those changes are so that they actually work well for everyone. So the goal of the model is really to encourage greater use of home dialysis and kidney transplant for Medicare beneficiaries with ESRD, and we all are for that. They want to ensure all ERD beneficiaries have really the freedom and choice of treatment that works best for them on a personal lifestyle level. And of course, reduce those Medicare expenditures. We do need to keep that in mind as we look at these things, because it isn't an unlimited pot of money. But we really want to look at how to preserve and enhance the quality of care furnished to those people that are on dialysis or with kidney transplant. So this past July, CMS proposed changes to address health and socioeconomic disparities, and public comments were welcome. Of course, that date is long closed. So we are anticipating some changes. And how is it going to work? Well, it is a mandatory participation model. So approximately 30% of facilities, of dialysis facilities, were selected according to geographic areas. So it is in process. And really, payment adjustments will be made to the per dialysis treatment base rate, with incentives to work with beneficiaries and caregivers in the choice of treatment modality, and really to provide additional resources to support that greater utilization of home therapies and kidney transplant. The other model, the Kidney Care Choices, or KCC, was actually delayed until January 2022. COVID had a lot to do with that, and it needed some refinement. And again, this is a voluntary model. So for the 70% of the remaining dialysis facilities, they can look at it, and it's to provide incentives for delaying the need for dialysis in people with chronic kidney disease. It really does build on some existing value-based care models. So, so there is some premise to it. And we've had some experience with previous models. If anybody's familiar with the ESCO model, the comprehensive ESRD care model is kind of based on that premise. And the model creates financial incentives for providers to manage the care of Medicare beneficiaries with CKD stages 4 and 5, and to hopefully delay the onset of dialysis and to incentivize kidney transplant. Now, that's about all we know right now. We've been told that more information is coming, but not quite yet. So there's definitely more to come. And if the rollout's going to be in January, I think we got to be on our toes to make sure we get that information so that it can be instituted and people can participate. The Living Donor Protection Act of 2021 really prohibits certain insurance carriers from discriminating against and provides protection for living organ donors. Specifically, carriers may not deny, cancel, or otherwise impose conditions on policies for life insurance, disability insurance, or long-term care insurance based on an individual status as a living organ donor. The bill also expressly specifies that recovery from organ donation surgery constitutes a serious health issue and is eligible for employees' protected medical leave rights on the job. So very critical. In addition, the Department of Health and Human Services must update education materials on live organ donation. Again, getting that information out to include information on the benefits of live organ donation. I mean, it's great we promote making it easier and more acceptable to give organs, but we really need to make sure people know what the benefits are and how to access insurance for living organ donors. Now, both of these bills were introduced in February of this year. The House actually had theirs referred to a subcommittee the next day. The Senate has not even been referred to a subcommittee, so there's really been no action since it's been introduced. So I'm going to talk about how you can make an impact on that, because this is pretty important legislation that would certainly promote kidney transplant, which is really the goal of the administration. The Chronic Kidney Disease Improvement and Research and Treatment Act is really a bipartisan bill designed to protect the delivery of high quality care for people with kidney disease, and was reintroduced in the Senate and the House in January of this, or June of this year, I'm making up numbers. If passed, this legislation would really raise awareness of chronic kidney disease and end-stage renal disease, while also improving the understanding and promoting access to treatment. Again, supporting administration's goal to increase home therapies. Part of that would be to expand kidney disease awareness and education, really expanding Medicare annual wellness benefit to include kidney disease screening. It's right now not part of a standard of annual screening. And that, again, would be a huge step forward to identify that as part of the 37 million people that are walking around with chronic kidney disease. It also increases the Medicare kidney disease education benefit. There's some barriers to getting that benefit by who's providing it, where the education occur, and who can get it. So we're trying to expand that incentive because it's very underutilized. And really to look at barriers to kidney transplant and post-transplant care, and to start to invest in the understanding of the progression of kidney disease and the treatment of kidney failure in minority populations. So that's where some of the research comes in and some reports. And we really would look at creating an economically stable dialysis infrastructure and incentivize innovation. And Lori brought this up with one of the speakers. It's great. We have all this great technology, but if it doesn't get paid for, it doesn't get used. So it addresses some of those barriers. Also, to increase patient access to quality performance information. Again, if we're going to do all these measures, it is ideal to make sure people know what the outcomes are and are they working and what is it that we need to do, as well as expand some choice and coverage by providing Medigap access to ESR beneficiaries on the MA plans. COVID, well, we worked hard to ensure people with kidney disease were included in all the COVID waivers. And the White House partnership with outpatient dialysis clinics was a real win for us, which was announced in March. Through this partnership, it guaranteed that vaccines would be provided to dialysis treatment centers. They didn't have access to vaccine to give to the patients. So this partnership was part of a $10 billion investment to expand access to COVID-19 vaccines to some of our hardest hit and highest risk communities, which we know across the country. We know that the data clearly shows that those on dialysis who contract COVID-19 often have severe health outcomes with a 50% hospitalization rate and a mortality rate of 20 to 30%, which is extremely high. And we're going to keep working on making sure that people with kidney disease are included in some of these health initiatives, whether it's COVID or something else that's around the corner. And telehealth was one of the waivers that was instituted when COVID started to surge to protect people from needing to be exposed. And we'll talk about that a little more in a moment and some initiatives that are out there. And health disparities really became far more prominent in COVID. We know that COVID-19 unequally affected many racial and ethnic minorities in much higher numbers. And there were a lot of other barriers to that. We found a lot of people with low income did not have the bandwidth to do virtual visits and do telehealth visits. I myself had that issue. People didn't know how to use the technology. They don't know how to use their cameras. It was very difficult. And where were these people then getting their information? And wherever they were getting their information, are they able to interpret that information? Are they getting the right information? When we look at vaccine rates and education associated with that. So we know these healthcare disparities need to be addressed on access to healthcare information, equitable care models, and really to address the social determinants of health, which we know directly impacts outcomes. Telehealth, again, we saw sweeping changes with COVID-19, with the waivers allowing it to be much more flexible as to who could do it and when. And it was really offered across all state lines. Unfortunately, in order to keep them, Congress does have to require something to enact them. There have been quite a few bills that related to telehealth that would continue past the healthcare emergency. CMS is also proposing to extend Medicare coverage of certain telehealth to end in 2023 to help gather data that can be determined whether the services should be permanently covered. But again, that's just a proposal. Two important ones for us is creating opportunities now for necessary and effective care technologies, or Connect for Health Act of 2021. And it was introduced in the House and the Senate. And these bills expand coverage of telehealth services under Medicare related, and this is two of many, but the ones that impact us really have been introduced. And among some of the provision, it really allows CMS to waive certain restrictions, such as the type of technology that may be used. And there's things to be taken into consideration to protect rights and HIPAA violations and those kind of things. But we need to be able to broaden the accessibility of some of these, because some of these come with a big price tag. And to permanently remove geographic restrictions on originating sites, so the location of the beneficiary where you're located, and allows the home of the beneficiary to serve as the originating site for all services. It permanently allows federally qualified health centers and rural health clinics to serve as the distant site, and that's where the health practitioner is. So again, pretty important. And it allows the CMS to generally waive coverage restrictions during any public health emergency. So it gives them a little leeway to plan ahead, unfortunately, for the next crisis. Both have been introduced in April of this year. Both were referred to subcommittee, but unfortunately, no further action has been taken. Now we're still covered under that public health crisis, but we don't know how long that will last. All right, nurses, sorry, this is my little plug. We were hit prior to COVID, we were having significant areas of shortage around the country, but the impact of COVID on nursing really has been profound. And any support would be appreciated, and opportunities to really encourage more nurses into the field. And it's not just nurses, it's really almost any healthcare level provider. And there's two things that nursing has been monitoring. One is for fiscal 2022 funding for nursing education and biomedical research. It is for annual funding. This is something that's funded every year, but we're really hoping for an increase this year to fund nursing education programs, as well as research, which is essential to the advancement of new treatment and prevention strategies for people with kidney disease. So there's a win-win for nurses and people with kidney disease. The other one is the Future Advancement of Academic Nursing Act, and this really authorizes grants to support schools of nursing for program enhancement and infrastructure modernization, while simultaneously increasing the number of nursing faculty and students. In addition to the nursing shortage, we have actually had a faculty shortage actually for a number of years. And so it's only gotten worse. And to make it worse, because of COVID and some of the restrictions in the hospital, not everybody has clinical sites anymore. So we're not getting the hands-on experience that they need to graduate from school. So in addition, nursing schools will be able to use the grant funding to increase the number of faculty and students in order to enhance industry preparedness for public health and emergencies, and really modernize the nursing education programs. Because obviously, if we're going to have restrictions on where clinical experiences can be, we need to really modernize. And not all university colleges have the facilities to do that. All right, so where do we go from here? Let's start looking at where you're currently at with your legislative activity level. And the next two slides really look at levels of activity as identified by Victoria Boyce. It was tweaked a little bit for this presentation because it was originally geared for nurses, but I think it's applicable to everyone. Are you registered to vote? And really, that's a great place to start. Did you vote in the last presidential election? Do you vote in all elections? Do you know who your federal representatives and senators are? And what about your state representative senators? Do you communicate with your legislators? Are you a member of a legislative response team? Do you meet with a legislator? And we're going to talk about some opportunities to do this. Now we're kind of moving up the activity level. Have you attended a political party meeting? Have you made a financial contribution to a candidate party or a PAC? Have you volunteered to work on a campaign? Have you attended legislative committee hearings? And those are some of those markups when they're reviewing legislation. Have you provided testimony for a legislative committee? And again, that's giving your experiences on a particular bill or subject. So it's not as difficult as you think it is because there's a lot of experience, I'm sure, that is on this call. Have you ever worked on an issue, position, a task force for a legislature? They do reach out many times, and they want people with certain experiences. And I have done that a few times, and unfortunately, it's usually not me. They usually want to talk to a person with kidney disease. So I make that link for them. Round with a party delegate or run for public office. Wouldn't that be amazing if we could get more people, whether you're a person with kidney disease, a family member, or a healthcare provider, to run for a public office? How powerful that would be. Knowledge is key and a great place to start because I love this quote, you can't use knowledge you don't have. And then it's real critical to stay current. And you're certainly taking that step by participating in this presentation today. And I appreciate it. So I want to spend a little time now starting to look at, what is it we can do? What are the opportunities that are out there? Because it really is essential to know what the state of the state really is and to know yourself. When you're looking at the state of the state, what issues relate to your personal passion? And that's really kind of how I started getting involved in advocacy, because I was actually surprised the first time I met with a legislature that really knew nothing about healthcare. And I felt that I had enough experience that I could educate them. And the Renal Support Network has a wealth of resources on their website and really is a great place to start. So if you haven't kind of tooled around with it, I highly encourage you to do that. And I'm going to refer to their website a few times today so that you can get a feel for what really is available. The National Kidney Foundation also has resources for people with kidney disease, their families, and healthcare professionals. They also have an advocacy section with additional resources, and they actually have one of those advocacy in one of the things that you can sign up to be informed of when there's an alert and participate. So they're another great resource for you, and I'm going to share a few more, as we move through this, but these are two really good ones. So really start at the beginning and educate yourself. I briefly reviewed the process. It's far more complex than that, but you can get active on the state and in the federal level. And again, the Renal Support Network is a great place to start. You can see here they have Kidney Care Advocacy 101. So with a few simple clicks, you're on your way. And you got to start somewhere. So why don't you start where it's really easy? So not sure who your representatives are? Well, guess what? Renal Support Network is an easy way for you to locate your officials on the federal and the state level. Again, some simple clicks. You do need to fill in your information because it does matter where you live. And you hit a button and they provide you a list of everybody that represents you with all of their contact information. And again, how easy is that? And you can actually print it because if your memory is not good, I know mine's not. It's very easy to go ahead and click print. Now it's time to take action. The Renal Support Network actually has two pieces of legislation important to people with kidney disease, both of which I reviewed today. Of course, that's the Living Donor Protection Act and the Chronic Kidney Disease Improvement and Research and Treatment Act. So literally with a few simple clicks and filling in your name and address and email, you can send your representatives an already formed letter to support these issues. And again, it's very easy and a very great place to start. And you can already start to see as we look at your role in advocacy, just with the last few slides, we're moving up that level of involvement. I really, was thumbing around on the site, and I just have to bring this up. I love the idea of them sharing their successes, and it kind of stresses the importance of everybody getting involved, and just those simple clicks and sending letters. Everyone counts, and it really does matter. And as I said, those last two pieces of legislation, especially the donor one, really hasn't moved. And wouldn't that be ideal if we could get hundreds of people saying, please let this move. But the Comprehensive Immunosuppressive Drug Coverage for Kidney Transplant Act has passed, and that was on their site and will go into effect January 2023. And it will extend the immunosuppressive coverage past the current 36-month cutoff that's in place to cover medications for the life of the transplant. And we know we've had lectures on that today, that immunosuppressant medications are critical for those that are transplanted to lower the body's ability to have an immune response so they don't reject that precious donated organ. I mean, that really is a success story. Reaching out to elected officials. Well, this might be a little more scary, but don't be afraid to reach out. You know your life experiences, and they do want to hear from you. They really do. Don't assume that you don't know what they want. They don't know what you have, and who better to educate them? So start by going to their websites and sign up for their newsletters. Bring that information to you. And I can't say all, but I would bear to guess that most have newsletters that they send to your email box, and you can read at your leisure. And check their websites often, because you can really get to know what your representatives' priorities are, what they believe in. Again, when you need to start looking at who you want to vote for, you really want to vote for somebody that's going to represent you. And what better way to do that is to see what their priorities are. Many have town hall meetings, or mine has coffee hours that are located somewhere near where you live. And what an easy way to meet with them, or check them out, or hear what they have to say. And it really is kind of convenient. Not always at the best times for me when I work, but sometimes I work around that. Send an email. What an easy way to introduce yourself. Every beginning of every year, I send a letter to all of my representatives, letting know who I am and what I represent, and if they need any assistance in any area regarding, and I list a few things out, I'm available to them with my contact information, and I have been called. Social media. Most are active on social media, which I'll touch base a little more in a moment. So again, another easy way, it comes to you. You see what they're putting out there, what they're posting. And once you really start to get comfortable, give them a call. Usually when you call their office, you talk to a legislative assistant, but it's actually their job to make sure that the call is known to the representative. So don't assume because you don't talk to the representative directly, it doesn't mean anything, because in fact, it may mean more, because it's those legislative assistants that do a lot of the work. And you can always arrange a meeting or schedule a tour. One of my state representatives holds a tour once a month, and he has kind of like a lottery, and he will take you to our state capitol building and give you a tour. So until you go to their website, you don't know what they're willing to offer. So I highly encourage you to take the opportunity to do so. Oh, look at this, more from the Renal Support Network. They actually have a social media toolkit, if you will. And we know that social media is really a mainstay, right? It's been a very valuable tool to stay in contact with everybody. So why would your elected officials be any different? And it's really easy to follow them on every social media platform where they have a presence. And some use more than others, and you kind of get a feel for that. So if you don't have an account, you can sign up and start in a matter of minutes to get information again coming to you. And Renal Support Network has compiled some tips and tools to make it even easier for you to communicate with your representative via social media. So they have tips on Facebook, Twitter, Instagram, and they even explain the use of hashtags. So don't be intimidated by that. They'll help you through it. And once you work with them, check their Facebook sites or their Twitter sites or the Instagram site for any changes or anything that they may put out there as a priority. Especially if they represent legislation, they'll definitely put it out there for you. So you can jump on board with that. Because I really focused on policies related to kidney disease. Maybe your passion's environment, or maybe your passion's public safety. Those are things that are important to you, then those are the things you need to look for. Again, staying up to date. And there's lots of ways to do this. Keeping your ears on general news. Newspapers I know are still around, even though some of them are online, to really see what's going on in our areas, communities, and on the federal level. Social media, again, has a big presence. And what about other organizations? There are other opportunities out there. I already mentioned Renal Support Network. I mentioned the National Kidney Foundation, but I want to share a few more for you. Kidney Care Partners. Kidney Care Partners was founded back in 2003, and it's really a coalition of the entire kidney community. So it's patient advocates, which Renal Support Network is part of, the dialysis professional care providers like the American Nephrology Nurses Association, researchers, and manufacturers dedicated to working together to improve the quality of care for individuals living with kidney disease. And they have quality priorities, regulatory priorities, they have a legislative agenda, and they really you can look at them to see what the priorities are and what they're working on. And again, it's a pretty easy site to look around and gather information on what's going on. And the American Nephrology Nurses Association. We have a website as well, and we have a site specific to health policy, and anybody can go into it. And if you look at our Take Action section, we have additional letters, including those two I mentioned relating to nursing priorities. We also have the Kidney Donor Protection Act, like RSN, and we also have, the Kidney Disease Research Act as well. So you can actually go into our website and with simple clicks, fill in your information and send those preformed letters of priority actions. So we have quite a bit of resources available to you too, and available to anybody that goes to the website. Going even broader, when we look at healthcare, we have the American Nurses Association. And they have a lot of information and a lot of training on the legislative process as well. And ANA urges HHS to declare nurse staffing shortage a national crisis. So you can see where their priorities are, which would be expected. But again, it's a great place if you're looking to gather information. That's a good place to start. And what about others? You can go to your party affiliation, whether you're Republican, Democrat, or other, independent. They all have websites, and they, again, all have newsletters, and they all have information that'll come to you. So whatever's important to you. The League for Women Voters is also another great place. They have a lot of information. Again, they're not necessarily related to healthcare, but it kind of broadens whatever your passion is. We also have the state network. They have newsletters as well. I sign up for their newsletter. They kind of give you some hot topics, what's going on in some of the state levels. And I'm sure there are many others when you start looking around for sources of information that would be there available to help you. Are you registered to vote? What a great way to for your voice to really be heard. The law does not require citizens to vote, but voting really is an important part of any democracy. By voting, you are participating in the democratic process. You vote for the leaders who represent you and your ideas and that support your interest. Voting really is your right, so don't take it for granted. Voting is more than just electing the candidate. It's choosing the right policies and people who who have your best interest in mind when making decisions that affect your community, your state, and our nation. So when you vote, you're taking an active role in deciding issues regarding healthcare, equal opportunity, infrastructure, jobs, education, Social Security, neighborhood safety, taxes, everything. It's that important. And remember, if you choose not to vote, someone else will. So do you really want somebody else deciding for you the laws that will affect you and your family and your community? So voting gives you the power to choose your city, state, and country and how it will be run. And guess what? Renal Support Networks has a very easy way for you to register to vote. Again, a few simple clicks and fill in some information, and you can get registered to vote. So let's go ahead and look back at that activity level again. So register to vote, obviously easy to do and highly encouraged to do. It's a great way to get your voice to be heard. Obviously voted in the last presidential election, and vote in all elections is a choice for the future. You can easily find out who your federal and state representatives are. We gave you resources for that. We gave you easy ways to communicate with your legislatures. Being part of a legislative response team, several of those websites have legislative response teams, National Kidney Foundation, the American Nurses Association. Again, you get a text or you get an email with a link to go ahead and respond. And we provided some easy ways to meet with the legislature. So some of what I covered today kind of gave you some groundwork to really begin to get active. You really have the information they need to make decisions. And that's really the message here. You have the power to take action, and there are many, many tools to assist you. And more importantly, you have the knowledge to take action and really to move forward with the information. Don't keep the information and your experiences to yourself. I encourage everyone to speak up and educate your elected officials about the needs of people with kidney disease. You know they can help the legislation related to kidney disease, access to treatment, dialysis, transplantation, and even organ donation. You know the impact when the resources are not there when you need them, and we're experiencing that every day, even on a little level, and they need to know that. Those who choose not to participate in democracy are doomed to be controlled by those who do, by Abraham Lincoln. And I believe these words have never been more true in today's environment. Not participating is as much of a decision-making as participating. I think this is a powerful slide because 2/3 of eligible voters don't vote. So yes, you can make a difference. And I want to thank so much for your time and attention today. And I'd really like to thank the Renal Support Network for inviting me today to talk a little bit about my passion and advocacy. So I'd like to open it up for questions.
Donna, thank you so much. You covered almost all of the bases. I mean, probably all of them. The first one is that people have to be involved, and you need to be a registered voter. And the Renal Support Network is a great place to get information and become active and learn how to do those things. And Suzette has shared in the chat our action buttons. I actually help Lori as a patient advocate with our Advocacy Ambassador program and trying to help motivate and help patients navigate on how to not just meet their legislators, but to develop a relationship with them so they can be the go-to person, so they can be a person of influence, and so that we can get them to vote in our best interest. And I really did. I like the fact that you brought up telehealth. Telehealth during COVID for someone who is immunosuppressed was a godsend. And the only drawback that I saw was that every doctor's office seemed to be using their own telehealth. Is there any type of a movement where that would be something consistent, where they would all be using the same type?
There is no movement on something like that. I think we were all taken a little bit by surprise, trying to implement them as quickly as possible. I have a hospital-based clinic, so my patients have to go through the clinic or the hospital to come see me. So we needed to go virtual right away. And so we used a different platform than everybody else. And we found actually the platform we initially selected was a little bit too complicated to use. The waiting room areas, people got disconnected. It was very, very difficult. So we had to actually change our platform to one with a smaller bandwidth so that people could use any phone in order to do that. But right now there's no action on that. And COVID's not gone, right? I mean,
No,
COVID has
no.
not gone away. I'm from Michigan, and we always seem to surge a little bit ahead of the curve, if you will, and our numbers are suddenly going back up. So we're looking like we're going to head into a fourth surge. And so we're going to have to re-implement some of these things very, very quickly. And I work in dialysis access. So for those that aren't sure, it's for hemodialysis to have something placed in your arm so that we can do the dialysis procedure. And it's very difficult to do virtually, but it's our only way to make sure people are safe. And so we really are, I stay attuned to the telehealth because that is my critical thing, is making sure we have the right systems and can be used on any phone.
Sure. So with Renal Support Network, 2 legislative acts that we have really embraced and tried to reach out to our representatives about, our legislators, is the Living Donor Protection Act, something that is really important to a lot of us, right? Myself included. My brother was my donor, and I would hate for something to happen where a living donor would not have that protection. And then the other is the research and innovation. And, I, as well as many people who are participating today, I had no idea that I had, even a risk for kidney disease. And that education is a component of that act, isn't it? About getting out information to the general public. Right. Mm-hmm. Right.
And we really need to, healthcare is always based on a problem, right? I mean, and primary care is a little more used to looking preventative, but when you look at the fact that annual kidney screening is not necessarily part of that, and certainly isn't paid for by Medicare, it is almost alarming to me. And so we really need to push to make sure those little screening items are, so we know when to start preventing progression or even identify if they will progress. Not everybody progresses, right? So that's why I think that piece of legislation is so critical. Now, saying that particular legislation was drafted by Kidney Care Partners in collaboration with representatives. And it kind of has a kitchen sink philosophy. There's a lot of components to it. So that in of itself is not likely to proceed. But our goal is always to have pieces of it get attached to priority areas for representatives. So we're always watching for opportunities. When Medicare Advantage had passed for people with end-stage renal disease, that was actually part of our act. So we have successfully taken these large components. And our goal really is to really hone in on that education and really preparing people well in advance before they get to needing dialysis and kidney transplant. I mean, I think that's the bigger issue. We don't assume everybody's going to go there. Are they really ready? And how do we slow it down? So yeah, it's critical.
Wonderful. Well, yeah, I can't agree with you more. And thank you as well as, as a healthcare provider, pointing out about the shortage of nursing and that this was around before COVID. I have a number of family members that are nurses, and I also have a sister-in-law that is a nurse educator. And I know personally for the last 10 or 15 years, she's been doing more than her share of work. And I don't think that the general public really understands the burden that sits on the shoulders of our healthcare professionals whenever we have understaffing. So we do have a question. We want to get that in. And it is, I received a call from my healthcare provider, Kaiser, that they will no longer cover 100% of my home dialysis. Starting in January 2002, we must pay 20% of the cost. The details were not finalized yet on a call to be aware of the change. Do you have any comments?
I don't have any comment, but I would call your insurance company and start shaking some chains. squeaky wheel sometimes works very well. That is very concerning to me. But there are a lot of health providers or health programs or insurance companies that don't necessarily make dialysis a covered service. So we got to be very, very careful. And that is very alarming. I thank you for bringing that up. It's something I want to look into.
Super. I do want to add that in the chat, I had asked if anybody had contacted their representatives, and there were a few people who were not involved in our advocacy group. And I would like to invite you to email me, share@rsnhope.org, and we can talk about it and see if it's a good fit. And someone also asked in the chat, they wanted to know if this information was going to be up on our website. Suzette was gracious and shared many, many links that we have. And this program, all of them at Renal Support Network Hope Week, will be on our website as a video. So you'll be able to tune in and watch them again. Donna, do you have any last parting words?
I think it's critical that we all step up and get involved. Can you imagine the numbers? I mean, if you think that there's how many millions with chronic kidney disease that even know it, if we all stepped up and wrote a letter supporting an issue, we'd have to be heard. We would have to be heard. And what better initiatives than the two that are posted on the RSN website? So, and please vote. I mean, it really does matter. Even if it's on the local level, I mean, you do and can and will make an impact. Thank you.
Thank you, Donna. Thank you for coming today. And thank you for being a guest at Hope Week.
Thank you.
And a shout out to our corporate mission partners for making this happen.